Hello. This is a summary of my interview with an Indigenous person. Unfortunately, the Spark video I created, the sound stopped working, so I will just be doing a quick video. I was able to interview someone I used to work with who is part of the Cree First Nations. The Cree make up the largest group of First Nations people and are from northern areas throughout Canada. The woman I interviewed is actually from the Northwest Territories. My first question was, how would you describe your health and the way you care for yourself? Do you believe your Indigenous background has an effect on your health? As some background for this question, I'll share that she is overweight, smokes heavily, and does drink every day. Her response was that she's in fairly good health. She does have diabetes, but manages it with diet. She brought up her brothers, who are also diabetic as well, and stated that they both have it worse than she does. She enjoys getting out for walks, so that is what she'll do for exercise. She thinks that the way she grew up, there wasn't much discussion about healthy eating or exercising, and perhaps that's due to her being Cree, or maybe it's just because she's older. She says everyone smokes around her, and she has tons of people in her life that are old who smoke, so she's not too worried about it. The second question was, when accessing healthcare, do you feel respected and that any of your cultural beliefs you have are respected? She replied by saying that she really never goes to the doctor. She used to, but it left a bad taste in her mouth. She lived on a reserve in the Northwest Territories and used to go to the healer there as a young adult and child. But now she'll avoid doctors at all costs. I asked if she did go there, was something she would appreciate the healthcare staff acknowledging. And she said the reason she had a bad experience is because she felt like people were always looking down on her with judgment. They would inquire about health practices that she had and then make her feel ashamed of what she was doing or how she was caring for herself or her family. And she always felt like she was doing something wrong. My next question was, as a whole, what do you perceive as the biggest barriers to health among Indigenous people? She responded by saying that there are so many barriers. Living in a remote area when you're on a reserve is the biggest one. And when you get to the healthcare facility, people don't take you seriously or stereotype you. The cost is also an added issue. Even though healthcare is free, you have to pay for medications. And sometimes she just feels that it's better not to know. They also tell you at these healthcare facilities that you can't do things that you've been doing your whole life, or you shouldn't be doing them. And she found that the healer would help her with one thing, but the doctor would tell her that she shouldn't be doing that, or she shouldn't be taking something that would mix with her medications that he would want to prescribe. The last question is there one thing that healthcare staff can begin to do that you think would improve health outcomes for Indigenous communities? And she said not to have a snobby attitude and actually make people feel comfortable about coming into a doctor's office or hospital and listening to what they have to say, or trying to figure out how to accommodate what they do in their lives with modern or Western medicine. Another follow-up question I did ask her was, given the efforts of the government in the past to assimilate the Aboriginal cultures of Canada and the effects of colonialism, how do you think this personally affected how you view yourself? And she said that she feels very lonely off of the reserve, and other people don't really see what's underneath and what she went through growing up. She has problems with her self-esteem and image, and she has to keep telling herself to be thankful, because now she knows that we're moving forward, and she's trying to give her kids all the love and attention that they need and deserve, but she didn't get that as a child. Thanks for listening.